You have just read a case report and answered some comprehension questions about it. We will now explore that case report in more detail. As you listen to and watch this PowerPoint, you should get a sense of some of the issues to consider when writing case reports. Now this slide looks very dense. Don't worry, you don't have to read everything on it, but I just want to give you an overview of how a case report is organized. There are no strict rules for organizing a case report, but some logic is used here. This is the first paragraph. Notice how the first sentence introduces the patient and the main issue. Serena Times, an 11-year-old female, was admitted to the emergency department under Dr. Berry at 12 noon, August 14, 2010, with severe abdominal pain. The next few sentences discuss what was learned during the interview, mainly in order of importance. That is, the most important and serious issues are dealt with first. So her pain, then her diarrhea is mentioned, then her loss of appetite and weight, finally her family history and her anxiety. The second paragraph deals with further steps which have been taken in chronological order. So first, she's sent for an X-ray. Then a stool specimen was sent. Then a painkiller is given. Then a colonoscopy is scheduled. And then she receives education related to the colonoscopy. Okay, let's go back to the beginning and look at the case study sentence by sentence. Notice how many details are included in this first sentence. Now, it could have been written this way. Serena Times is an 11-year-old female. She was admitted to emergency on August 14, 2010 at noon. Dr. Berry is her doctor. She was experiencing severe abdominal pain. But then each of those statements is equally important. The way the sentence is now written, the details are still there, but they're less important than the main focus. The main focus is that Serena Times was admitted to emergency with severe abdominal pain. In the second sentence, notice that the writer doesn't just say that the patient was in pain. Instead, he gives factual evidence of what he heard. He heard her scream. He heard her say something. Notice that the writer doesn't say her pain is a 10, but instead says that this is what the patient described. The writer is being objective. Also notice the details. Where her abdomen was palpated is important. In this sentence too, the writer emphasizes objectivity by saying the mother said something, rather than stating the diarrhea as a fact. So the patient's mother stated her daughter has had diarrhea, not the client has had diarrhea. Notice also the switch in tense in this sentence. Has had diarrhea, that's the present perfect. The present perfect is used to indicate something that started in the past and is still true or relevant in the present. That's the diarrhea. Started in the past and she still has it, I assume. Now, the past tense, had blood in her stools, is used to indicate something that happened once in the past, and that was the blood in her stool. In this next sentence, again, notice the switch in tense. The patient states. States is the present tense, and that's used to describe a present fact. She states that she does not feel hungry anymore. present perfect, has lost, is again used to indicate something that began in the past and is still true. That is, her weight loss began in the past and it's still true. Okay, now, family history of is a good phrase to learn for a nurse. Patients may have a family history of heart disease, of asthma, of allergies, a family history of diabetes, a family history of breast cancer, for instance. Okay, in this sentence, again notice the switch in tense. Here, present tense describes true facts. She has a family history of bowel disease. She is terrified. The simple past describes events that happened at a point in the past. Her grandfather died. Her mother stated something. Present continuous is used to describe their experience at that moment or that period of time. So is causing anxiety. Okay, in this sentence, we again move back to the simple past tense because the interview occurred in the past. So during the interview, which happened in the past, the patient appeared pale and exhausted. Now, the word appeared is used instead of was to emphasize that the writer is being objective and describing what he saw. Now to the second paragraph. In much of this paragraph, the passive voice is used to keep the focus mostly on the patient. I'm going to read it to you in the present, in the active voice. It could have read, Dr. Barry sent Serena for an abdominal x-ray. Nurse James sent a stool specimen to the lab. I administered a painkiller. But the focus isn't on who did what. The focus is on the patient and on the tests. So Serena was sent, a stool specimen has been sent, a painkiller has been administered, and she, that is Serena, is scheduled for a colonoscopy. This is a bit different from an incident report. In an incident report, the focus might indeed be on the nurse's actions and the actions of the other people in the incident. In that case, if the doers are important, the active voice would be used. Note the tenses that are used in this second paragraph. Simple past is used for the x-ray that happened and is finished. But present perfect is used for the stool specimen. The stool specimen was sent to the lab, but using the present perfect, has been sent, gives the idea that we aren't done with it yet. The results aren't in yet. Similarly, with the painkiller, we could say it was administered, but Serena's sleeping now, so the effects of the painkiller are still being felt. Therefore, has been administered, that is the present perfect, is more precise than was administered, that is the simple past. Present perfect is also used for the explanation. The nurse explained the procedure, but the procedure hasn't happened yet, so the explanation is still relevant in the present. And what's happening now? She's resting, and that's the present continuous. Based on the discussion of this case report, following are some things to consider as you write your own case reports. First of all, incorporate details into longer, more complex sentences. Second, use and change tenses to express the timing of events, that is, use present tense for statements of fact. Use past tense for one-time events that have been completed. Use present perfect for symptoms that began in the past and are still happening. and for events that happened in the recent past and they are still impacting the present or still relevant to the present. Third, be objective. Fourth, use the passive voice to keep the focus on the patient. And last, use a logical method of organization. I hope that this discussion has helped you to identify some important considerations when writing case studies.